Hi, everybody. Welcome to Pheo Para Awareness Week 2023. My name is Miranda, and I'll be speaking on behalf of Pheo Para Alliance and on my own personal experience. I have been living with metastatic pheochromocytoma for almost 9 years, very soon approaching 9 years. And I have lived with pheochromocytoma in my life for, I think, 13 years or more. I'm 32. I've had a diagnosis of pheochromocytoma since I'm 19 years old. And like many of you, it was a difficult course getting there and a difficult course following up and receiving a recurrence diagnosis. Today, we're going to be talking about communicating your complex medical history, which I know that we all struggle with. And this doesn't matter if you've been diagnosed yesterday, or if you're like me and you've been living with this disease for many, many years. This is something that we need to remind ourselves of and feel confident and prepared. So I hope that this webinar makes you feel that way today. One thing we all have in common is that we're very rare. And that means that we're not going to be understood by everybody. And much to our surprise in the early days, even sometimes doctors can struggle with knowing the complexities of our illness, even if they understand the diagnosis. And oftentimes our conditions are only seen in a textbook or a learning setting, which can be difficult when the patient is sitting right in front of them. So I find it to be intimidating sometimes to be the one to explain it. And yet we add this layer of nerves and anxiety, and our unpredictable bodies are flaring up, and we're not able to control our fight or flight response. So sitting in that office with all of that taken into account, I'm going to get you through this. We're going to get through this together. So I asked a open poll on what was the most difficult common concerns from our Pheo Para community. And I'm going to go through them one by one. And these were the responses sent in by you. So some of the most common concerns I hear are feeling pressured to go too quickly, choosing which part of your history is relevant. That's a good one. Knowing which language to use with each doctor, meaning do we get super technical and medical and textbook, or do we use our emotions and use emotional language? Feeling minimized or misunderstood, not being taken seriously. Feeling the need to minimize in fear of this. Yeah. Not knowing how many symptoms to disclose. Scared of being honest in fear of seeming dramatic. Feeling like you're going to be judged or dismissed. Fear of misdiagnosis. History of psychosomatic diagnosis. Symptoms blamed on psychological reasons. I'm seeing a trend here. Being too clinical or unemotional. Appearing too well and not being taken seriously. Have that problem. Being told not to Google. Being told that you're reading too many patient forums. Experiencing medical gaslighting in any form. Having to endure another appointment where you're told you're fine. That one hit. I have experienced every single one of these concerns. And it's not to say that I have a perfect guidebook or a perfect plan each time, but I try my best. I try my absolute best to share the tools that I've learned and to better prepare you, in turn, continuously reminding myself. So we're going to prepare for two different settings. One thing that we all, I think, have in common is that emergency medicine is not the most friendly for rare disease in most cases. Shout out to the heroes of the emergency room that do get it. And then we're going to, of course, talk about a regular appointment. So I'm going to encourage you to take notes, get your pen and a pencil, get a notepad, or just write in your phone. But these, I think, will be helpful to each and every one of you, or I hope so. So preparing for your appointment, this will differ if you're meeting a doctor for the first time, or if it's an existing doctor that you're following up with, and also if it's a phone appointment. So one thing that I like to do if it's a phone appointment is, or even actually any appointment, I really like to have the previous correspondence from my last appointment. So if this is a new doctor, this could mean that it could be the last correspondence with the most relevant doctor that you've seen. Or if it's a different doctor, then you're going to want to, I don't know if I just confused that, but that's Pheo brain. Basically, have the previous correspondence from either a new or an old doctor. That way, you'll be able to pick up where you left off confidently and just know where you left off. I find that really helpful. And so first and foremost, this is number one. Now we're starting a little list. Number one is to write down each concern that you'll have in lists of priority. So this is different from questions we're going to get into afterwards, but we want to write down the concern. So for example, I have flank pain. I have a spasm in my throat. I have a uncontrollable blood pressure. Like, I'm going to want to write down my concerns because they are different than questions we will ask. So number one, write down the concerns and make sure that they are in the list of priorities. So prioritize the most important ones first, second, third, fourth, fifth, and then have, depending on how many concerns you have, and then have the least important ones at the end. And I know that can seem difficult to categorize that way, but we have to. Because if you don't get to every single thing, you're going to be so happy that you did it this way. 2, write down the 2 most important questions. This is not for the doctor, this is for you. So first question is, what do I want to achieve at this appointment? That's so important because it gives you a concept of focus. It gives you an opportunity to say, okay, what would I like to get out of this? And then the follow-up question that I have is, what would be the best outcome of this appointment? So when we can know what we want to achieve, we can kind of visualize what that looks like. Okay, my perfect appointment would be that this doctor would order such and such test and he would prescribe such and such medication to help with these issues. And of course, you're not a doctor, you don't need to know all those things, but just have an idea of how it could provide clarity to you, how it could improve your life. So we want to think about that, because if we don't understand what we want to take out of the appointment, it's very difficult for the doctor to help you. And it's also so important to know where to place your energy, because preparing for these appointments is not something that is easy. It's something that takes time, and it takes a lot of brain work and hidden work, as I recently was told that the hidden work is something that is overlooked in many people with illnesses and disabilities. 3 is your pre-appointment prep question list. So again, your concerns in the list of priorities is different from the pre-appointment preparation that you're going to do. And this is going to be your question list. So Of course, you're going to have questions as you go in the appointment. That is normal. There's going to be things that come up that you couldn't have anticipated or planned for. But these questions are going to make sure that you can refer back to what you originally needed to know so that you can stay on track. And that's so important. Number 4, write out your expectation for the test you want. So most of us with rare disease, it seems like a really weird thing to go into the doctor and say like, oh, I want such and such test. But no, it's not weird at all, because there are times where we're in the diagnostic phase and we need those tests in order to confirm, or we're in the follow-up stage, or like me, we're in the surveillance stage. So there's a lot of different reasons why we'd want specific tests. And sometimes they're not ordered or just not all of the ones that you wanted or needed for your specific concerns. So just important to like kind of think about what your expectations would be for the test that you want. And how to do this is to probably talk to your peers, talk to your friends in the Pheo Para support group, talk to Pheo Para themselves, refer to the education page. You can go to my own personal blog. Like, there's a lot of ways of doing this, but try to have that written down. Number 5, focus. Focus, focus, focus. When you have a complicated medical history, it's so easy to go off topic or become very emotional. I like my medical resume for this. You're probably wondering what that is. I wish I had it handy, but ultimately it's a binder, a folder, a duotang, anything that can hold the most relevant points of your medical history. It's going to include your date of birth, your name, your allergies, your medications you're currently on. It's going to include special notes that are only relevant to you. It's going to include any previous diagnostics you've had, any previous surgeries or treatments you've gone through. It's going to include everything, like a resume for a job. So it's like you're going to apply for a job and you're saying, pick me, love me. I have pheochromocytoma and I'm allergic to iodine, you know? So just to give you an idea and a resource for that, if you don't already have something that is made, it can feel really overwhelming and very difficult and you're not sure where to start. I have a resource personally on my blog. If you go to any of my social media pages and you go to the link in my bio, you're going to be able to see medical resume how to. So just click on that and it's going to take you to a page. I even provided the resource pages, the urgent protocols, the things that my doctors have prepared for me, or are just universal to all patients for mast cell disease and for adrenal insufficiency. And you kind of have to do your own thing with, your pheochromocytoma and your own needs, of course, but it'll get you started and it'll give you some really important, very, I'm going to say just very important resources for yourself. So anytime that it's going to be normal that your doctor is going to want to know a recap. So you're going to sit down and they're going to say, okay, so why are you here? Or they're going to say, so you have pheochromocytoma. Tell me a little bit about that. And so depending on where you are in your own experience, this can be years of information or it can be just weeks of information. So, and even then it can be very convoluted. So it's important to know that they're going to want to explore the original diagnosis, the surgery, the treatment. But sometimes it can feel like it's too much, like the appointment is taking a turn where it's just focusing on older history that may not be super relevant to the current situation. This is something that I experience often, having lived with this disease for that many years. Is important for me to sort of lead the way when it comes to my care, because we can get fascinated or caught up in these, rare details. And I personally don't have the energy or the pain levels to support sitting in an office, talking to residents first about my complicated medical history and then reiterating everything to the doctor and focusing on these past situations that may not be incredibly relevant. It's important to tell them, to note them, to be honest about them, because everything in your history is relevant. It's just to be mindful of the amount of time you spend in that space. So how do we control that, right? Like how do we control when we're showing up, and typically it's the doctor or the physician or whoever you're seeing is going to lead the way. As patients, we don't think that we have the ability or the we're intimidated, and we don't feel like it's okay to lead the way. But I really want you to think about the switch in dynamic to where the doctor is there to help you, to serve you in your own health journey. And so you are the CEO of your health. You are showing up in a way where, you are making sure that everything is done correctly, it is done to your standard, it's done to your comfort level. So it's okay as a patient to lead the way in your own appointment. And how you do this is it's hard for me to convey how to assert a confident presence, but it's so important to have those previous prepared items that I discussed, because if you have something to go off of, if you have a list that you can sort of check off, you're doing the same thing as what they would typically be doing, but you're leading your charge. So I know my doctors are overbooked, they're busy, and it's okay to ask them questions, and it's okay to assert yourself and, be an expert patient. Because if you let them lead the way entirely and you don't ask any questions and you wait for that moment where they give you the opportunity to ask all your questions at the end, it's not going to come. Sometimes that appointment can end so abruptly, and often it's because they think that you didn't need anything more from them. Like they're rushing and they're busy, and they go through their own checklist without giving you the opportunity to do yours, because it's an assumption that you are okay, because you didn't come with a boatload of concerns. So be the person that comes with a boatload of concerns, because it will benefit you in the end. So in your appointments, it's so incredibly vital to be honest. This is something that I struggle with sometimes, because a lot of us are used to saying I'm fine and trying to blend in with others and trying to feel understood and trying to feel like we're semi-normal, right? But in that office, you're not normal. You're rare, you're complex, you have a lot of concerns, and you need help. And if we mask too much and we say we're fine and, kind of use our humor and all those things that we're used to doing to cope, it's not the time in that office. Appointments are the opportunity to share your realest struggles, your most difficult pain, the things that you absolutely need done, the priorities. So as much as you can, be honest. Appointments are hard enough when you have past medical trauma, when you've experienced medical gaslighting, when you've been misdiagnosed for a number of years or months, or however you got here. And so I find it's important to remind myself that all you can do is try your best. Whatever the outcome, it's not your fault. Just show up and do your best. An important tool that I find helpful is to include documents from other physicians. So, for example, if you're not confident in conveying the message about your condition, or you feel like it's difficult to talk, for example, I still find it difficult to explain mast cell activation syndrome to my doctors who don't know what it is. I feel like intimidated because I've become such an expert with my metastatic disease and my adrenal insufficiency and the protocols and what to do, that I don't have that same confidence when I'm trying to convey that message. So I always like to include my documents from my other physicians, my immunologists, and vice versa. so that everybody feels like they have a better understanding, but in their own language. So for me and for them. And again, remember to come in assertive and follow from your list. It will tend to follow the direction you're taking it. And I really hope that for you. Now, here's the reality. Most often, you will not get every concern covered at that appointment. So even if you waited months and this is the specialist that can do all the things and you thought that it would all be taken care of, it's so important to not get discouraged at this stage because this is where your follow-ups will come into play. So you have your less urgent concerns now. You've taken that priority list of concerns. You've maybe checked off the first 5 and you have those 3 waiting for you. And although those 3 things are still very important because it affects your daily life and your quality of life, but it's probably something that can be observed by a different doctor that you have on your team or your family physician, your GP. So you have more context, you have another perspective, and just remember that every appointment we go to, even if it's hard, we always take something away from it. When we're misdiagnosed or undiagnosed, we take away what it's not, right? We remove these other factors that can no longer cloud our vision. And then we go into the next appointment or to the next doctor with a more, a different clarity, and we can reconfigure our approach. So the more eyes and ears, the better with rare disease. That's my personal thing. Something that's important to understand is that if you're dismissed by a doctor or feeling like they're not taking you seriously, and this is, again, I've tried to capture every single concern that was on the original list from you guys. So if you're feeling like they're not taking you seriously and you're being told that you're anxious or whatever the case is, I've been there for many, many years. And I was so hard on myself, thinking like it was always something that I could have done better. But you did everything you could. There's likely nothing you could have done to change the outcome of that doctor's opinion. And that's so important to understand and to hold with you, hold in your heart, hold in your brain, hold in your space, because it's not your fault. And we don't need to be carrying around that shame, right? So you did the best you could and it's not your fault. I want you to write that down. You did the best you could. It is not your fault. Okay? You can do your very best, right? We can do our very best and we can communicate our complex medical history to the best of our knowledge and ability. But if you're not being heard, it's time to speak to another one of your doctors who is listening. And this is very important for those of you who are undiagnosed or for going through that experience. It feels hopeless. It feels like you'll never, ever get somebody who will understand. It feels like you're never going to be given the medication you need to make your heart stop pounding and having these episodes and having your life taken over by this disease. But somebody will eventually listen. And it's our job to continue to bring our concerns to every doctor who will listen, no matter how hard that is. So the second portion of this webinar is to better prepare us for emergency settings, because those are the best advice. That's the best advice I could give for an in-office regular appointment that you have the ability to prepare for. But what about when you have no preparation? Can't really prepare because you're in an emergency and you don't have that luxury, you don't have that privilege of spending 5 days preparing for this appointment, for this exchange. So many of us have experienced medical trauma in relation to our complex medical histories when in the ER. And this is your most vulnerable moment that you're ever going to be in. And it feels impossible to explain and convey that message when you're feeling so unwell. That's why you're there, right? So I'm going to refer you back to the medical resume. This is going to be your lifeline in emergency settings, in unexpected settings. For example, I'm just going to give you a random example. You're going for a scan. You have to get iodine. You think you have an allergy, but you're not really sure. You didn't get prepped for it, but you typically have a little reaction. So you have this binder that's going to outline what you would do in the situation that there would be an emergency, such as an anaphylaxis. You can take that confidently to the physician or to the tech or whoever's helping you, and you can convey whatever's in there to them that's relevant at that moment. And this helps everybody feel more prepared to help you and to help yourself. So if you're going to emergency, typically it's like, we don't want to go. I just experienced that in the last few days. I had an anaphylactic event and I quickly declined over the next 2 weeks. And all of my conditions were being aggravated, and my cortisol was dropping low, and my mast cells were going crazy, and I still couldn't bring myself to go to emergency, even though most people would have. I sat there as a rare cancer survivor for many years, and I said, this is not at the point where I would go to an emergency room, because I know the toll that it takes in my body. And so that's a personal knowing, that's a personal self-awareness of like, okay, I can wait until Monday to see my normal doctors. But if I had needed to go, I knew that I was prepared, and that helped me so much to not feel stressed and not have that like need to go to the hospital, to just feel comforted or safe, like you're in a safe environment, which is really important to do in some cases. But I felt safe knowing that I had everything I needed to be prepared to show up if I needed to. So when I bring my medical resume, I'm going to include important documents to advocate for specific conditions, because I have multiple conditions. I have cancer, I have adrenal insufficiency, which means I need to be replaced on steroids, and I have mast cell activation syndrome, which means I can't take almost any medication. Like, there's a lot of contraindications within these conditions. And so it's easier to show up with something your doctors have prepared for you, signed it with your name on it, and say, okay, I have a really complex medical history, but I'm going to do my best. Here it is. And it's like you're handing it to them on a silver platter. And I can promise you, the nurses will feel like kissing you, because it's so well laid out. It's so easy. They don't have to waste their precious time asking you these continuous robotic questions. Everything's just there for them. And then they have these urgent protocols that they can make copies of and put at the front desk. And, you know, when you're admitted, they can bring them around with them. Like, it's just such an important tool. And I can't stress that enough. So again, click on the link in my bio. You'll find it in my social profile, and you'll be able, even if you just visit pheoversusfabulous.com, you can find it there. These situations require some allies, some backup, if you will. We don't want to just go in alone and say, okay, here's my medical advice. Like, we can, of course, if that's the only option, of course, that's what we have to do. But if you have the ability to put in a call to your doctor, and your doctor says, you need to go to emergency, this is something that I cannot help you with, well, that doctor can become your ally in that situation, because whether it's the on-call doctor or your specialist or your, whoever, they have the ability to help you navigate emergency. So here's some tips I'm going to really urge you to take with you. You can ask them to put a call in to the emergency center that you're going to. That's the first option. They can email you to help you go through triage and to help the emerge doctors know what you need most in that moment. So this is something that commonly happens to me when I go to emergency. It's typically a last resort because my doctors say like, no, this Miranda, this one's an emergency, you need to go. And so I have them in that moment to email me and tell me what their best opinion is in that moment, what they think I need, and then I go in with that. And then I let the emergency doctors, of course, do their own workup and their own navigation process. But I just find it helps to have something physical from your doctor to say like, this person's here, she's a little complicated, but we can do this. This is what we need to do, right? Like, doesn't that just seem so much less stressful? So I find it just helps to like break it down in their medical lingo and not from a patient, because that's when we get told like, oh, you need to stop Googling so much, or you should stay out of the forums. It's like, yeah, okay. And if it's late at night, you don't have this ability because it's too quick and urgent, well, again, we're just going to rely on our medical resume to lead the way. I would really recommend bringing an ally with you, bringing a physical person, and it doesn't matter who it is. Just make sure that person knows what to say and how to say it. So, example, make sure they know to refer to your medical resume, something that you may not be in the condition to be able to communicate. And last, most important, you have to know that there will be times that all of the above suggestions, tips, toolkits, survival guides, all these things that we learn, in the moment, it can just fly out the window, right? Everything we know can just, and we need to remind ourselves to do the best that you can with the tools that you have, whether that be a medical bracelet to communicate your illnesses, and the most important things are on there. So that should be helpful in these situations. This is something I show to all of the doctors, nurses, anyone who comes in my room and touches me sees this bracelet. If you don't have that medical resume, if you don't have those things to help you communicate, this is something that can just be like the bare minimum, and it just gets the questions going, and it helps you to be able to navigate that really difficult time. So, and then you just have to trust that it will be okay, no matter what happens, no matter the outcome. And a little piece of advice that I'm going to leave you with is, throughout all of this, we're very hard on ourselves, and so many difficult constructs in all of this. And so we have to be able to give ourselves grace. And the only way that I can do this is I think about how I would answer a fellow Pheo Para friend that comes to me in the support group, or is a personal friend and texts me in the middle of the night, tells me about their emergency experience. Like, I have to think about what I would tell them in that situation. And that is how we can provide ourselves with the same grace that we give other people. Living with a rare disease is not easy. Nothing about this is easy. And there will be times where we get burnt out. Medical burnout is a real thing. And we have to do so much work in order to just show up to a simple appointment. We had to do a whole webinar on communicating our complex medical history. So just give yourself space to take care of yourself during that process. Because I know a lot of us, we think like, well, this is survival, we're in survival mode, and we're trudging through, and we're trying to just get it all done, and we're trying to get our answers, and we're trying to feel better. But in doing that, we can feel so much worse because it's too much. I'm averaging 2 appointments per week. Each one requires travel. Like, there's so many things to add in. Like, again, that hidden work that we don't see each other do. And each one of us is unique and different. And so I always have to remind myself to put aside the time for aftercare between each one of these appointments. Because when you average like a week of preparing for the thing, and then however the outcome went, and then you have results and like you have anxiety leading up, but there's a lot of factors here. And we're living with a very all-consuming, very rude tumor or tumors. And they don't care if we're tired. They don't care if we're burnt out. They don't care if we're like, overwhelmed. They're just like, I'm just going to keep putting you in fight or flight. So we have to be the ones to sort of control our own nervous system and do our very best. That's all we can do. All we can do is do our best. And I sincerely hope that with the tools and the advice that you've learned here, this is 13 years of my experience kind of, smashed into one little session. I encourage you to continue to talk amongst yourselves, to talk within the group, to talk within the patient Zooms, anything that you have available to you as a resource, because there's always going to be new tips and new things that other patients will remind you of based on their own experience, because we're all unique and we're all rare. And I think that no matter where you are in this, you're not doing it alone. And I say that because I hear from people every single day, and I think to myself, there's this big group, Pheo Para has all these resources, but a lot of us are doing this really alone, and we don't have that, that tribe behind us. And so I really I encourage you to find your people, sign up for the patient conferences with Pheo Para Alliance, and look through their website, look through my blog, reach out to me, reach out to anybody. Just don't do it alone, because it's really hard and we need people, we need help. So out of all of those concerns that we talked about, feeling pressured to go quickly, not being heard, I hope that each one of those concerns were addressed. And I hope that you enjoyed talking amongst each other during the webinar. I am wishing you a very happy Pheo Para Awareness Week. It's the 4th annual Awareness Week. And just put this in perspective, 13 years ago, there was no Pheo Para Awareness. 9 years ago, when I got my metastatic disease diagnosis, recurrent terminal diagnosis, I didn't have anybody who had that disease. I didn't have anybody to look to. I didn't have a group. I didn't have Pheo Para Alliance. And now we're sitting here, Pheo Para Awareness Week, and we're all learning from one another. And we're going to continue to share our stories and share our knowledge onto the next generation of people who are being diagnosed with this disease. And we're going to continue to help doctors understand us so that we can be better diagnosed and just live more freely and fearlessly with this disease. So that is, I think, everything. And I am so thankful that you were here and listened to this whole webinar. And I can't wait to connect with you. So you can find me at Pheo versus Fabulous on all social channels. And thank you, Pheo Para Alliance, for being such a good ally for all of us. And I'll see you next year. I'll see you before that. But if you have any questions, you can also email or message Pheo Para Alliance, or you can email me or message me directly, again, all through my social channels. And I'm more than happy to answer questions. So stay fearless, stay fabulous. Bye.